Here we have the classification of and location of cranial nerves and the nuclei. This is taken from the Neuroscience 6th edition textbook. I will include in a link. The location is in the midbrain. We have different locations we can be in. It's the midbrain, pons, and medulla, and somewhere in between. We have somatic motor, branchial motor, visceral motor, general sensory, special sensory, visceral sensory. In the midbrain, we'll find the third and the fourth, which is oculomotor, and the trochlea, just inferior. Branchial motor, none. Branchial motor are none. There's no branchial motor in the midbrain. There's visceral motor, or the Edinger-Westphal, for the third, or the oculomotor nerve. There is this. We've moved on into sensory. For the trigeminal, we have the trigeminal mesencephalic sensory for the fifth and for the seventh cranial nerve, or the trigeminal and the facial. So trigeminal and facial nuclei for general sensation is in the midbrain. In the pons, we have the abducens nucleus for the very same name, its namesake, the abducens nerve, or the sixth. In the pons, we also have a branchial motor element, or the trigeminal motor nucleus. It gives rise to the. It receives fibers. No, it gives out fibers for the fifth and the seventh, or the trigeminal and the facial nerve. Then we have visceral motor. It is the superior salivatory for the facial, and the inferior salivatory for the glossopharyngeal. After in the pons, we also have the somatic general sensations. Have the trigeminal principal sensory and the principal trigeminal sensory nucleus, which gives innervation for the fifth, the trigeminal, the seventh, the facial, the ninth, or the glossopharyngeal, and tenth, the vagus. We also have special sensation, or also called the between the pons and the medulla, the vestibular nuclei for the eighth cranial nerve, the vestibular cochlear nerve, and the cochlear nucleus for also the eighth, the vestibular cochlear nerve. We also have the nucleus of the solitary tract, which is important visceral sensation, visceral sensory, which has receives fibers from the seventh, the ninth, and tenth for visceral sensation, facial, glossopharyngeal, and vagus. In the medulla, we have the hypoglossal nucleus, which is somatic motor. It just innervates the tongue, which is not considered a branchial. Well, it derives from branchial arches, but the nerve itself is not branchial, so it's still a somatic motor. The nucleus ambiguus we can find in the medulla, and the spinal accessory nucleus of the trigeminal. The spinal accessory nucleus, which innervates the 11th, or the accessory nerve. Nucleus ambiguus gives fibers to the 9th and 10th for branchial motor control of the glossopharyngeal and vagus. The visceral motor element includes the nucleus ambiguus in the medulla for the tense, or the vagus, and the dorsal nucleus of vagus, which is for obviously the tense. And we have somatic general sensation. We move on to sensory now. In the medulla for the trigeminal sensory spinal nucleus. Now we're correct because I got confused here. For the fifth, or the trigeminal, the seventh, or the facial, the ninth, the glossopharyngeal, and the tenth, the vagus. Trigeminal sensory spinal nucleus. And that is the classification and location of cranial nerves nuclei. Hope you enjoyed this.